So here I am. I'm at Dr. Lipov's office, about ready to go get this shot. This is for, I've dealt with depression for a long time in my life, guys, and just being transparent and open about this and showing you guys potential options that can help you down the road. I've flown all the way over to currently in Chicago at Dr. Lipov's office, and we're going to be filming this. Dr. DeFina has been my man here. So this is just a little bit. Dr. DeFina, tell them, what are we doing exactly here? So
okay,
Facebook Live, everything. But
today Ryan is going to be receiving a stellate ganglion block injection in 2 different points. The first procedure will be C6, the second procedure will be C3, and this is done in order to reboot and regulate a lot of the neurochemical activity, which in turn is reflected in normalizing electrical activity and magnetic fields in the brain, which modulate emotions, behavior, specifically reducing depression and anxiety. And we've had some really excellent results with thousands of people. So we're looking forward to Ryan, a former U.S. service member,
yes,
Army. Thank you for your service.
And you as well.
And it's relatively short. Propofol is given in order to, just put him out briefly. The injection is done by Dr. Lipov, my associate anesthesiologist, who basically is the founding father of this particular type procedure for PTSD. And then he'll go in for the second procedure. It's all done under fluoroscopy, so the needles are guided by X-ray, and it's very good, very effective, and hopefully you're going to be feeling a lot differently.
Yes, well, I appreciate your support and all this. And as I was just sharing it earlier on, I've suffered from depression. I'm very open about the depression and the anxiety that I've dealt with, which kind of has me have ADHD symptoms that I've suffered from for a long time because of all this as well. So under your guidance, you're advising me to do this and stuff, and I trust you.
And we're following up with QEEG-based neurofeedback,
which we're going to show on a video here tied into this one, guys. This will be a splice video where you'll see us talking about the new neurofeedback device. It's a $20-something thousand, about $25,000 total.
It's a DSI multi-channel 19-lead whole head device, which we will talk about.
Yes.
And all of this is done under the auspices of research from the International Brain Research Foundation.
Definitely take a look at, what's your website?
www.ibrfinc.org. And also our clinical work is done through Neuroscience Advanced Systems. Dr. Eugene Lipov, Lipov,
yes,
/PTSD. You'll get many videos. You'll see him on the Doctor Show in LA, which has been on over 20 times with various
he's
patients.
been on the Doctor Show over 20 times there. Then after watching him, it's like, this seems like the standard procedure that the Doctor Show is really recommending for depression and PTSD, kind of in a sense, and not really get them, and obviously there's other parts of the treatment
Absolutely.
Involved,
different pathways in the brain, typically using standard drug treatments. Drug regimens have a lot of side effects. Oftentimes they have minimal or not sustainable main effects, and people are not compliant with them. So this is a much better, non-invasive, minimally invasive neuromodulation procedure, which has a long-term effect. We have about an 85% sustained recovery rate.
That's phenomenal right there. So I'm looking forward to meeting Dr. Lipov. All right. Thank you, brother.
Bye.
See a video of me getting knocked out. Cool.
Oh, that's gonna be me this weekend.
Yeah, I think you'd be good.
I kinda wanna get out of the